Navigating the unknown, a personal journey of caregiving for a loved one with dementia. Caring for a loved one with dementia can be one of the most challenging experiences of your life. When a family member has dementia, it can be difficult to know how to navigate the unknown. The journey is often unpredictable, and you may find yourself struggling to provide the best possible care for your loved one while also taking care of your own needs. In this post, we will be sharing a personal journey of caregiving for a loved one with dementia. We will discuss the challenges faced, the lessons learned, and the valuable resources that can help you and your loved one through this difficult time. Whether you are just starting on this journey or have been caregiving for a while, we hope that this post will provide you with some comfort, inspiration, and practical tips to help you navigate the unknown with grace and compassion. 1. The beginning of the journey, recognizing the early signs of dementia. Recognizing the early signs of dementia in a loved one can be difficult and emotionally taxing. It's important to understand that dementia is a progressive disease and early detection can help with managing symptoms and planning for the future. Some of the early signs of dementia include forgetfulness, difficulty with familiar tasks, confusion about time or place, trouble with language, changes in mood or personality, and difficulty with problem solving or decision making. It's important to note that these symptoms can also be related to other medical conditions or medication side effects, so it's crucial to consult with a healthcare professional for an accurate diagnosis. Once a diagnosis is made, it's important to have open and honest conversations with your loved one about their care preferences and options. This may include discussions about living arrangements, financial planning, and end-of-life planning. Navigating the unknown of caring for a loved one with dementia can be challenging, but with early detection and proper planning, it can help ease the burden on both the caregiver and the person with dementia. 2. Finding resources. Where to turn for help and support. Caring for a loved one with dementia can be an incredibly challenging experience, and it's important to remember that you don't have to go through it alone. There are many resources available to help you navigate this difficult journey. One of the first places to turn for help and support is your loved one's healthcare team. Their doctor, nurse, or social worker can provide guidance on available resources in your community, including support groups, respite care, and home health services. Another option is to reach out to organizations that specialize in dementia care. The Alzheimer's Association, for example, offers a wealth of resources and support services for caregivers, including a 24/7 helpline staffed by trained professionals who can answer your questions and connect you with local resources. You may also want to consider joining a support group for caregivers of individuals with dementia. These groups provide a safe and supportive environment where you can share your experiences, ask questions, and get advice from others who are going through similar challenges. Finally, don't underestimate the power of your own social network. Reach out to friends and family members for help and support, whether it's to run errands, provide respite care, or simply lend a listening ear. Remember, caring for a loved one with dementia is not a journey you have to undertake alone. By finding and utilizing available resources and support, you can provide the best possible care for your loved one while also taking care of yourself. 3. The importance of self-care. Taking care of yourself while caregiving. When it comes to caregiving, it's easy to forget about ourselves as we focus entirely on our loved ones. However, it's important to remember that we can't take care of others if we don't take care of ourselves first. That's why self-care is crucial for caregivers. Self-care can take many forms, from taking a walk outside to practicing yoga or meditation. It's about finding what works for you and incorporating it into your daily routine. Taking care of yourself can help you manage stress, which is a common and very real issue for caregivers. Another important aspect of self-care is seeking support from others. This can come in many forms, such as joining a support group, seeing a therapist, or talking to friends and family. It's important to have people in your life who understand what you're going through and can offer you emotional support. Finally, don't be afraid to ask for help when you need it. Caregiving can be overwhelming at times, and it's okay to admit that you can't do it all on your own. Whether it's asking a family member to take over for a few hours or hiring a professional caregiver, there are resources available to help you. Remember that taking care of yourself isn't selfish. It's necessary for your own well-being as well as the well-being of your loved one. By practicing self-care, you'll be better equipped to handle the challenges of caregiving and provide the best possible care for your loved one with dementia. 4. The impact on family relationships. Navigating the emotions and changes. Caring for a loved one with dementia is a challenging journey that not only affects the individual with the illness but also their family members. It's an emotional roller coaster that can test even the strongest of family bonds. The impact on family relationships can be overwhelming, as the dynamics of the relationship change from a traditional parent-child or sibling relationship to a caregiver-patient relationship. This change in roles can be difficult to navigate, especially for those who have never been in a caregiving position before. Family members may also experience feelings of guilt, anger, or resentment as they grapple with their loved one's illness. It's important to acknowledge and address these emotions, as they can have a significant impact on the family's relationships and overall well-being. Communication is key in navigating the emotions and changes that come with caring for a loved one with dementia. Family members should openly discuss their feelings and encourage each other to do the same. It's crucial to listen to one another without judgment and to work together to find solutions to any challenges that arise. It's also important for family members to take care of themselves during this time. Caregiving can be physically and emotionally exhausting, and it's easy to neglect one's own needs while caring for a loved one. Family members should prioritize self-care, seek support from others, and take breaks when needed to avoid burnout. Overall, navigating the impact of dementia on family relationships requires patience, understanding, and open communication. With empathy and support, families can work together to provide the best possible care for their loved one while maintaining strong relationships with one another. 5. The challenges of decision-making. Making choices on behalf of your loved one. One of the biggest challenges of caregiving for a loved one with dementia is making decisions on their behalf. As the disease progresses, your loved one may not be able to make decisions for themselves, leaving you responsible for making choices regarding their care, finances, and overall well-being. This can be an immense burden, as the decisions you make can have a profound impact on their quality of life. It's important to have open and honest conversations with your loved one while they are still able to communicate their wishes and preferences. This will give you valuable insight into their values and beliefs, making it easier to make decisions that align with their wishes. In some cases, you may need to consult with doctors, lawyers, or financial advisors to make informed decisions. It's important to seek out professionals who are experienced in working with individuals with dementia and their caregivers. Remember that decision-making can be emotionally challenging, especially when you are making choices that you know your loved one would not have wanted. Be kind to yourself and seek support from family, friends, or a support group. You are not alone in this journey, and there are resources available to help you navigate these difficult decisions. 6. Learning to communicate effectively. Navigating new communication challenges. Communicating with a loved one with dementia can be a very challenging experience. As the disease progresses, it can become increasingly difficult to find the right words and phrases to communicate effectively. It's important to remember that the ability to communicate may vary from day to day, so it's important to approach each conversation with patience and empathy. One effective communication strategy is to simplify your language and use short, clear sentences. This can help your loved one better understand what you're saying and respond appropriately. You should also try to avoid using abstract concepts or complex ideas, as these can be confusing and overwhelming. Another important aspect of effective communication is to listen actively and respond with care. It's important to show your loved one that you're actively listening and that you care about their thoughts and feelings. You can do this by maintaining eye contact, acknowledging their feelings, and responding in a calm and patient manner. As the disease progresses, your loved one may also experience difficulty with nonverbal communication, such as facial expressions or body language. In these situations, it's important to pay attention to other cues, such as tone of voice or changes in behavior, to better understand their needs and feelings. Overall, effective communication is key to navigating the challenges of caregiving for a loved one with dementia. By simplifying your language, listening actively, and responding with care, you can help ensure that your loved one feels heard and understood, even as the disease progresses. 7. Managing difficult behaviors. Tips and strategies for dealing with difficult behaviors. Managing difficult behaviors can be one of the most challenging aspects of caring for a loved one with dementia. People with dementia can exhibit a range of behaviors that can be difficult to manage, including agitation, aggression, wandering, and sundowning. These behaviors can be triggered by a range of factors, including changes in routine, medication side effects, and unmet needs. One important strategy for managing difficult behaviors is to try to identify the underlying cause of the behavior. This can involve observing the person's behavior and looking for patterns or triggers. For example, if the person becomes agitated during mealtimes, it may be helpful to offer smaller, more frequent meals throughout the day. Another strategy is to use redirection and distraction techniques. For example, if the person becomes agitated or confused, it may be helpful to redirect their attention to a favorite activity or object. This can help to calm the person and distract them from their distressing thoughts. It's also important to establish a consistent routine and environment for the person with dementia. This can help to reduce confusion and anxiety, and make the person feel more secure. Keeping the environment calm, with minimal noise and distractions, can also be helpful in managing difficult behaviors. Finally, it's important to take care of yourself as a caregiver. Caring for a loved one with dementia can be exhausting and emotionally draining. Be sure to take breaks and seek support from family, friends, or a support group. Remember that you are not alone on this journey, and that there are resources available to help you manage difficult behaviors and provide the best possible care for your loved one. 8. The role of technology. How technology can assist with caregiving. Technology has come a long way in recent years, and it has been a game changer for caregivers. There are many different tools and resources available that can assist with caregiving for a loved one with dementia. One of the most beneficial things about technology is that it can provide a sense of safety and security for both the caregiver and the loved one. For example, there are GPS tracking devices that can be worn by a person with dementia who may wander off or become lost. These devices can help locate the person quickly, giving family members peace of mind. Another useful technology is medication management apps. These apps help caregivers keep track of medication schedules, reminding them when it's time for a loved one to take their medication. Medication management apps can also alert caregivers if a medication has been missed or if there are any potential interactions between different medications. Technology can also provide a way for caregivers to stay connected with their loved ones. Video chat apps like Skype or Zoom can be used to connect with loved ones who may be far away. This can be especially helpful for those who may not have the ability to travel or leave their home. In conclusion, technology can be an invaluable tool for caregivers of loved ones with dementia. From providing a sense of safety and security to helping with medication management and staying connected, technology can make a caregiver's life much easier. It's important to explore different options and find the tools and resources that work best for your specific situation. 9. Finding moments of joy. Cherishing the good moments in the journey. Caring for a loved one with dementia can be an incredibly difficult and stressful journey. Amidst the challenges, it's important to remember to find moments of joy and cherish them. These moments of joy can be small, but they are incredibly meaningful in the midst of a difficult journey. It's important to take time to celebrate the good moments, no matter how small they may be. These moments of joy can come in many forms. Maybe it's a smile from your loved one, a moment of clarity, or a shared laugh over a fond memory. Whatever it may be, take the time to appreciate it and savor the moment. These moments of joy can provide a much-needed boost of positivity and hope in an often overwhelming journey. It's also important to create opportunities for moments of joy. Maybe it's playing your loved one's favorite music, going for a walk in nature, or simply spending time together doing an activity they enjoy. Creating a positive and joyful environment can help to alleviate some of the stress and anxiety that often come with caregiving. Remember, while caring for a loved one with dementia can be challenging, it's also an opportunity to share moments of love and connection. Cherishing these moments of joy can help to make the journey a little bit easier and more meaningful. 10. Closure and moving on. Adjusting to life after the journey of caregiving. As the journey of caregiving comes to a close, you may feel a sense of loss and confusion. After all, caregiving has become a significant part of your daily life and identity. It's essential to recognize that your feelings are valid and that there is no right or wrong way to feel. One of the first things you can do is to give yourself time to grieve and process your emotions. It's normal to feel a sense of emptiness, even if you know that caregiving was taking a significant toll on you. Take some time for yourself to reflect on the journey and remember the moments of joy and love that you shared with your loved one. It's also important to seek support from family and friends or professional counselors. They can help you work through your emotions and find ways to move forward. For some, it may take time to rediscover their passions and find a new sense of purpose. For others, it may mean continuing to advocate for dementia awareness and support. Whatever the case may be, know that you have grown as a person from this experience. You have developed new skills, patience, and empathy that you can carry with you for the rest of your life. As you adjust to life after caregiving, be gentle with yourself and take things one step at a time. With time and patience, you will find your new path and move forward with resilience and strength. We hope you found this personal journey of caregiving for a loved one with dementia helpful. It's not an easy task to take care of someone with dementia, but you are not alone. We hope that by sharing our experience, you find comfort, support, and guidance as you navigate your own journey. Remember that it's essential to take care of yourself as well, and don't be afraid to ask for help whenever you need it. Thank you for reading, and we wish you all the best in your caregiving journey.